Flu cases are on the rise across the US. What you should know. Flu season is beginning to pick up momentum in the United States as colder weather settles in and people spend more time indoors, creating conditions that help respiratory viruses spread. According to the latest data from the Centers for Disease Control and Prevention, CDC, influenza activity is intensifying in several states and experts are warning Americans to prepare for a potentially challenging season. There's been a notable increase in flu activity. During the first week of December, about 8.1% of respiratory tests nationwide were positive for influenza, a sharp rise compared with just 1.6% about a month earlier, roughly 4 times higher, indicating that flu activity is clearly trending upward. At least 4 states, Colorado, Louisiana, New Jersey, and New York, are currently experiencing high levels of influenza-like illness, according to CDC surveillance data. In the week ending December 6, more than 6,800 patients were hospitalized with flu across the United States. That same week marked the first pediatric death linked to the flu this season, a concerning milestone for health officials tracking the virus's impact on children. Is this season a serious threat? Well, while flu season always varies in intensity from year to year, experts are watching global patterns closely. A newer strain of influenza, a variant of H3N2 called subclade K, appears to be driving much of the increase in cases in parts of Canada, Japan, and the UK, and it's now circulating in the US as well. This variant may be slightly better at evading existing immunity than prior strains, making it easier for some people to get sick even if they were vaccinated or previously infected. However, infectious disease specialists stress that this doesn't mean the virus is inherently more dangerous, just that the immune system might not recognize it as well. Current flu vaccines are still expected to offer protection, especially against severe disease, hospitalizations, and deaths, even if the match isn't perfect. Why does this matter for you and your family? Well, flu season typically peaks in January or February, meaning the United States may still have its worst weeks ahead. Dr. Peter Chinhong, an infectious disease specialist, notes that some regions, particularly New York, are seeing flu activity start earlier and rise more sharply than usual, which could be an early sign of a heavier season. Respiratory illnesses like the flu can spread rapidly through schools, workplaces, and family gatherings, especially during the upcoming holiday season when travel and indoor contact increase. Children, older adults, pregnant people, and individuals with chronic health conditions remain the most vulnerable to severe complications. Tips to reduce your risk. Experts recommend a few key steps to protect yourself and others. Get vaccinated. The CDC recommends flu vaccination each year for everyone 6 months and older, with rare medical exceptions. Practice good hygiene. Wash hands frequently, cover coughs and sneezes, and routinely clean commonly touched surfaces. Stay home when sick, avoid exposing others if you're feeling unwell, and consider wearing a mask in crowded indoor spaces. Seek medical advice early. If you suspect the flu and are at high risk for severe illness, talk to your doctor about antiviral treatments that can lessen symptoms and reduce hospitalizations. Until next time, stay informed, stay healthy.